We have been looking at progress of the hospital reform process, HRP. Remember, the hospital reform process largely looks at making hospitals independent from the Ministry of Health with the aim of improving planning, increasing ownership and accountability at hospital management level, and this will improve the service for the population served. Management from all the central hospitals has been trained already, and everything in hospital management has been covered already.
These hospitals had strategic plans which expired 2 or 3 years ago. So when I came in, my first responsibility was to ensure that we develop strategic plans for the two institutions. So that has been done. For now, we have even costed the strategic plans. What is remaining is to finalize the budgets, because they're huge, almost 90 billion in 5 years. So we are trying to see these budgets realistic. So that's what we are doing now. The other role has been ensuring that there's efficiency in terms of service provision. I've ensured that these institutions are focusing on core business, and then non-core business is really outsourced. So we supported the institutions with outsourcing frameworks, capacity building on how they can outsource services that are not core. For example, stationery printing, issues of food, security. What procedures should they do or follow to ensure that outsourcing is done properly, so that they are efficient in service delivery.
The hospital directors have highlighted already that they can't wait to have these referral hospitals operate on autonomous status. But is the hospital management and staff really ready?
We have employed, in terms of nurses, for example, have now 150 more nurses than we used to have in the past. And even in the HR, I've seen that now we have Chief Human Resource Management Officer. So, based on the new establishment, we are employing more and more, and the government is respecting this new establishment. So, there's that. And secondly, there is increased capacity of staff. People now know what they are supposed to do. And when you know what you are supposed to do, you do it a bit quicker than before.
These reforms were supposed to take place yesterday. It has been long overdue. Hospital needed to be standalone institutions, because a number of things that take place in the hospitals, especially disciplinary issues and even budgets, they are supposed to happen here at the hospital. The situation like now, before the reform itself, it's like we cannot discipline officers from a certain grade and above, like all those from grade K above. We cannot institute disciplinary issues, let alone refer them to our head office along with Capitol Hill. So in those situations, it becomes difficult to discipline people immediately.
Although the Ministry of Health will still be in control, especially with policy guidance, a number of experts working at central hospitals look at the hospital reform as a greater way of dealing with so many challenges that come with bureaucracy when dealing with the ministry.
For me, with my directorate, I would be interested in the human resource. Because human resource is very important for us to achieve a quality patient care. Because for the staff establishment, which maybe we have been proposing to the ministry, it's very difficult for us to get the one which we want. So we know with reform, if we be the one managing our own human resource, It means we'll be able to hire, maybe, and fire for those who are not working, and in so doing, there will be like sound management of our patients.
Here we work sometimes in a laissez-faire sort of, but if you go, you take the same nurse, take that nurse to Maiwatu. There they know that whatever I do, I'll be fired. So they perform better than in government, because they know that in government, for a discipline to be enforced, it takes time. So you have people that are in a sort of, even though a manager can be working hard to make things work, but sometimes people just feel there's nothing that this manager is going to do with me. So it's that power, I think, is what the reform was bringing.
Management from all referral hospitals is ready. But is the Ministry of Health ready to let these hospitals operate independently with boards of directors?